Hello, welcome to Healthy Eyes Hub. In today's video, we will talk about the cornea. Please tell us what you want to know about the eyes in the comments below and subscribe if you haven't already. The cornea is a dome-shaped transparent covering at the front of the eye. It acts as a windscreen to protect the eye from injury, harm, and bacteria. The cornea meets with the sclera, that is the white of the eye, at the limbus. The cornea has the largest refractive power, bending light rays entering the eye for images to be formed on the retina. From outwards inwards, the cornea has 6 layers, namely the epithelium, Bowman's membrane, the stroma, pre-descemet or Duess layer, descemet membrane, and the endothelium. The epithelium is the outermost layer of the cornea. It is a physical barrier lying between the world outside and inside of your eye, and it is unfathomably sensitive to pain. It is estimated that the cornea has approximately 300 to 600 times as many pain receptors as the skin. This sensitivity is a protective feature which makes one to strongly react to remove or stop whatever is hurting one's eyes. Now, Bowman's layer, which is the second layer, is a tough layer made mainly of collagen. Its presence is to provide structure and help the cornea to hold its shape. The stroma is the thickest layer of the cornea. It strengthens the structure of the cornea and helps to refract light rays, focusing images of objects onto the retina. The fourth layer, which is the pre-descemet layer, also known as Duess layer, is an airtight layer of the cornea, which serves as a very strong barrier separating the fluid inside the eye and the air from the atmosphere. The pre-descemet layer is a relatively recent discovery. The first research paper describing it came out in 2013. There is still some disagreement among experts on whether or not it's a layer on its own or if it's part of the stroma. Mind you, experts thought pre-descemet membrane was part of the stroma until recently newer research suggested that might not be the case. Yet available research shows several important differences between the pre-descemet layer and the rest of the stroma. Now, eye surgeons take the pre-descemet layer into account regardless of whether or not they think it's a separate layer when planning corneal surgeries. Descemet layer, which is the fifth layer, is thin but stretchy and remarkably strong. It is important as it helps to protect the inner part of the eye from infection and injury. The final layer, which is the endothelium, is the innermost part of the cornea. Its main responsibility is to ensure fluid balance in the cornea and the inner part of the eye. It also helps to ensure there is adequate fluid in the stroma for your cornea to properly accomplish its function. In order to maintain transparency, the cornea does not contain any blood vessels. The tear film nourishes the cornea externally, while the aqueous humor feeds the cornea internally. The nerve fibers that innervate the cornea also supply it with neurotrophins. The corneal epithelium contains thousands of nerve endings that lend its high sensitivity to contact with foreign objects. Also, the density of nociceptors, which are pain receptors in the cornea, is estimated at 300 to 600 times that of the skin. Let's look at what happens when the cornea gets damaged. The person with a damaged cornea has to undergo surgery. The surgery done is referred to as corneal transplant. The damaged cornea is removed and replaced with corneal graft. Corneal transplant can be divided into 2 main types. The first type of corneal transplant is penetrating or full thickness keratoplasty, where the whole of the damaged cornea is removed and replaced with a new one. The second type of corneal transplant is partial thickness corneal transplant. The type of partial thickness corneal transplant performed is primarily determined by the condition of the cornea in the receiving eye. In descemet stripping automated endothelial keratoplasty, that is DSEK, descemet's membrane and the endothelium are replaced with a corneal graft including some stroma, while the superficial layers of the recipient cornea are left intact. Some physicians roughen the peripheral stroma with a scraping device to aid adherence of the graft. On the other hand, descemet's membrane endothelium keratoplasty, that is DMEK, is the least aggressive type of partial corneal transplant, as only descemet's membrane and the endothelium is replaced with donor tissue that does not include a stromal component. Another type of surgery that can be done is photokeratectomy. It uses an eczema laser to remove the diseased part of the superficial cornea. This procedure may involve scar removal, smoothing of the cornea, epithelial erosion treatment, and the changing of corneal shape. Some of the most common conditions that affect the cornea include allergies, keratitis, corneal foreign body, dry eyes, keratoconus, several types of corneal dystrophies, iridocorneal endothelial syndrome, infections, and injury. In our next video, we will further explain what these conditions are and how they are managed in clinical settings. Thank you for learning with me. Press the notification button and subscribe to receive new learning materials when uploaded.